Hometown Radio, KGAF presents the Community Service Report. Here is Dee Blanton.
It is time to do it again. The Community Service Program on this Thursday. Today coming to you from our friends at Muenster Memorial Hospital. Brian Roland, the CEO from MMH, is with us. How you doing, sir?
I am doing great, and I'm excited to be here this morning.
I appreciate you coming out on actually your day off to do this show.
Yes, it is. But yes, you're welcome. Thanks.
Yeah, it's not often we get folks as dedicated as you, so I commend you for that.
Dedicated, crazy. There's a fine line there.
I always think they go hand in hand myself. All right, several things we want to talk about. Everybody, I think all the water cooler talk the last couple of days is dealing with this Hurricane Florence. And I thought it might be a good idea to talk about how the medical community and hospitals prepare for something like this. We've seen all the evacuations going on and the boarding up of the buildings, but man, healthcare, you got to be there to help.
Well, I think one of the things you have to look at, and one of the things I really enjoyed seeing on the news last night was the hospitals being evacuated. Because what that means is, unlike New Orleans years ago when they had their flood, you weren't going to have patients that were tough to treat, not knowing if you could get people to you, not getting electricity, and some of those things. So they are well taken care of. They're going to be out of harm's way to the best of their ability. But I think the other side of that really is a passionate thing that people need to see is the people that take care of those patients are able to be with their families. Mm-hmm. And I think people really don't understand in the event of an emergency. And yes, they're first responders and their job is to take care of those patients. But you do have a family. And while you try to prepare to the best of your ability for these type of things, and the fact that you have 2 or 3 days notice that this is coming somewhere on the coast over there in that certain area, to have that a little bit of assurance that you can get out with your family. And I love the fact that a lot of people are heeding the warnings, because the scarier part that I see is actually healthcare in that region for the next 2 or 3 weeks. Yeah. Because if the rains do what they say they're going to do, and the storm surge and the power outages, healthcare is going to be really tough. I mean, you look and see what happened with Harvey last year in Texas. And so I'm glad that there will not be a lot of people around there, because it really makes, from a healthcare standpoint, while we live by the people that we take care of, given this situation, you don't want to take care of people who could have gotten out of the mess. And I understand around us, there are a lot of things that happen. I mean, the rain down in South Texas now, the flooding we had in Fort Worth, where a couple of people lost their lives. But this is what I would call a planned event. And so I'm glad to see in South Carolina all the lanes leading out of South Carolina. Mm-hmm. We'll see what happens the next couple of days. Middle of the night tonight, it's going to hit somewhere. Category 2, 3, 4, depending on who you listen to, it fluctuates. But really, if you think about it, 120 miles per hour, 140 miles an hour.
What's the difference?
It's gonna blow.
Yeah.
So
exactly. Well, again, as you said, we will see. They're already feeling the effects of it, and it won't hit till around midnight tonight. So prayers for those folks, without a doubt.
Definitely.
We are getting close to that time of year. November is approaching. That is the opening of bill filing for the Texas legislature, and then the legislature convenes in January. And I know there are health care issues to be considered.
Well, it's going to be a fun legislative session. There are, they open up, the legislators all come back in January, but they can actually start filing bills on November the 12th. And there are already a lot of bills that are out there that affect rural health care. I will actually be down in Austin in February for Rural Health Advocacy Days to talk to some of the lawmakers and give them my 2 cents. Sometimes that's all it's worth when you're dealing with them. But and a lot of the stuff that's on the table right now, it can kind of go either way. There's pros and cons. We're looking at things right now that CMS is trying to pass or has a new regulation that if your hospital is not busy enough, if you don't see enough inpatients, they could change your designation. And you could lose a lot of the support that you get. We actually had a hospital in Texas already that got hit by that CMS designation change, and that could be really detrimental to a lot of rural hospitals. So when we look at that, that's going to be one of the things that we talk a lot about this session. The Medicaid shortfall. You know what? We want to take care of all the patients we can take care of, but you also have to get paid for doing that. And right now, Medicaid has shorts the hospital about $60 million a year on the care that they need. And so of the 161 rural hospitals right now, only 66 do OB. And part of it is because of that reimbursement. And I think you're going to see that continue to drop because of the cost of doing those deliveries, the liability, finding the provider. So that's something that really needs to be looked at. Another hot topic I think that we're going to be looking at this year is the tax caps for property taxes. And this is one of those where I understand both sides of it from a rural hospital setting, especially very rural where I've been. That tax money is sometimes your lifesaver, and you have to have it. However, I don't completely disagree with some of the changes that they want to make with taking those caps and dropping them down a little bit, just because it forces a little more transparency on why you need the money. My philosophy has always been, I want to get our hospital to where I'm using that tax money to better the facility and to add new services and new sites versus our day-to-day operations. And so, again, with Muenster, that we really haven't raised the taxes at all since I've been there. Again, this year, they're staying the same. And yes, there are ways around the tax caps. There are legal means to get around it if you have to. We won't go into that stuff. But so I think there's going to be a lot of changes in healthcare. There's a new HHSC commissioner coming on board in October. So whenever that happens, you wonder what's their thought process going to be. The person that's coming on board has worked in Louisiana, Nebraska, has a really good background with health, and the Health and Human Services Director handles basically all of that non-Medicare and non-insurance business, oversees all that. But that also includes the nursing homes and things along those lines. So there's a lot of pieces to that puzzle. So I tell you what, it's going to be a very, very busy and exciting, to a certain extent, legislative session. And then again, we've got the midterm elections coming up here in, 40 days, something like that. I think I heard this morning on the television. And who knows? Who knows who's going to be where?
And what new ideas, even beyond what we're talking about now, will be brought up, Well,
and the other side of that is what actually can get changed in that short of time, because that's the downside to the midterm. Sometimes is legislative stuff starts up so soon right after that, you're somewhat limited. So it's going to be a crazy legislative session. But again, that's the fun thing about healthcare. Our goal is we're planning today for a better tomorrow. And that's what we're going to keep doing.
It's the fun yet frustrating thing about healthcare, right?
A little bit of both, but it brings you back every day, even on your day off.
Absolutely. And again, thank you for doing that. We appreciate it. And we'll talk to you again next month.
Sure will.
Yes. All right, Brian, thank you very much. He is Brian Roland. He is the CEO at Muenster Memorial Hospital. And that's going to wrap it up for our community service program today here on Hometown Radio, KGAF.